Well, good morning. I want to welcome all of you. I'm the new guy in town, so I haven't met many of you, and my name is Victor Dzau, and it's a great pleasure to be working with all of you on this very important topic. So I just want to say a few words about first this whole area, which I think is so important. And welcome to you, welcome all of you to this workshop on quality of care in low and middle income countries. Sheila pointed out to me that, and because we're well aware that this is 15 years since our quality series that came out. And in fact, at the IOM, we're planning a big summit or symposium in the fall, not only to celebrate 15 years, but to look back and to critically look at what we've done, what has been achieved, what has not, and what we need to do going forward. So the timing is really great. Obviously, we recognize that that particular series is very US-centric, or perhaps centric to many OECD countries, but the question really remains, the principle remains important, remains about the issue that you want to talk about, which is what about the other countries in low and middle income countries. At the Institute, we are actually having a conversation among ourselves to talk about what the health and healthcare 2.0 should look like, given the fact that we will have a new administration. So in many ways, we have many reasons to come back and relook at the quality chasm series and about those 6 particular principles and recognize some modifications, some expansion, etc. Now, on the topic you're dealing with today, particularly in looking at low-income countries, middle-income countries, I happen to feel very strongly, and I've done personal work in this area in looking at innovations in care delivery. And so my feeling when I heard about your workshop, I was quite excited about attending some of it and being able to, perhaps at the end of the day, tomorrow, close the meeting with some thoughts. So first of all, I want to thank USAID Standing Committee on Health Systems. Certainly, this is a great venue, IOM, for discussing how we can come together to build a system that not only do no harm, but ensure everybody's doing great care. We certainly see that in the Ebola issue about the need to strengthen health systems and the need to have, in fact, great quality of work to be done. For this morning, I just want to acknowledge the Workshop Planning Committee, Rifat Anton, Sheila Leatherman, and Kedar Mati for their great work. A big thank you for the staff who's dedicated to this, particularly Jillian Buckley, who's here, Raquel Pidlick, and of course, Patrick Kelly's on my right. As I said, tomorrow I'll say a few more words about, as you end the meeting, about some thoughts about where this may take all of us. And of course, Don Berwick is going to close the meeting, and I think he's going to have a lot of ideas of where we should be doing next. So I want to thank all of you for being here, and I want to turn the meeting over to you, Sheila.
Thank you, Victor, and thank you for your participation with us. I'm Sheila Leatherman. I'm a professor at the School of Public Health at University of North Carolina and a member of the Institute of Medicine and chairing this workshop and planning committee. I want to say thank you for getting here. I know many of you did heroic things to arrive, and we really appreciate it, and particularly for people who traveled from the Northeast or from around the world. I also welcome people who are attending by WebEx or other kinds of connections. I think you'll find that this is a unique meeting, a little bit different than the quality conferences that many of us attend around the world. And I want to explain to you its origin and purpose and take you through the next 2 days. As Victor said, this actually is an activity of the IOM committee to support USAID engagement on health system strengthening. It's an advisory committee that takes up a lot of issues, but quality is the focus here. So if I can, hold on. Okay, thank you. So we all know that there are a number of approaches and interventions around the world happening in low and middle income countries. And the good news is that the interest is growing and the pace of adopting and implementing interventions is actually accelerating. In many cases in low and middle income countries, the financing or sponsorship of quality-related activities is in part or all done by donors and governments, and they are navigating what we're calling an opaque market, meaning that there really is insufficient evidence in many cases to help inform their decisions of what activities or interventions to select. We also, I think, all know that the evidence almost across the board in quality of care in low and middle income countries, as well as in more affluent, is variable, sometimes sparse, sometimes quite a lot, often equivocal. And I would guess that there would be no controversy in this room that we could all agree that there's a need to better assess quality-related interventions in terms of their impact, their ability to get results, if they do get results, the sustainability of those results, cost effectiveness, and importantly, the ability to embed in routine operations so that these quality activities are not dependent upon external advisors. Next slide, please. This particular two-day workshop comes with a very specific statement of task from USAID, and that is the request to illuminate the evidence on 6 different methods commonly used by USAID missions to improve quality. And Dr. Jim Hybe will explain this a little bit more. But we will be looking at these 6, which are the list from USAID. The first, clinical in-service training. The second being supervision. The third, standards-based management and recognition, which is called SBMR. The fourth, called COPE, which is a client-oriented, provider-efficient method of quality improvement. The fifth is improvement collaboratives, and the sixth, facility accreditation based on external evaluation. Next, please. So to undertake this task and to be able to report out on it, we've designed this 2-day workshop with 5 different sessions. We are going to focus on the 6 methods, but we thought it was important to start wider to really understand the state of quality in low and middle income countries, and to also hear why USAID has this interest in broadly supporting quality over decades of work, but also the 6 methods. We will then zero in on the methods that I've named, and then again address some larger questions, in part assisted by a massive systematic review of evidence that has been done, breaking down various kinds of quality interventions into the component parts, and also talking about issues related to measurement, feasibility, and cost effectiveness. That will be day 1. Day 2 tomorrow. We will step back. We will try to synthesize what we've heard on day 1, and then very importantly, start to identify what are the gaps in the evidence and what are the implications of those gaps. We then want to break out into smaller, not so small groups. Everyone is invited to be in one of them. And those 3 groups will be basically a policy group answering this first question of how to create an environment conducive to improving quality of care, a research group which will answer the second question, how to advance our understanding of the field, and thirdly, a practice group which will answer, hopefully, a very important question of how do we accelerate progress in quality improvement in real time on the ground now. And then we will hear closing remarks and future directions from Dr. Dzau and Don Berwick, who will be joining us. So that's the 2-day lineup. I would like to, again, just say a few minutes of thanks to Jillian and Rachel, who worked arduously to put together the content and logistics for the workshop. I'd also like to thank some of the faculty and presenters in advance. This meeting is a little bit different than most, where everyone comes with their set of slides and does their thing. This required a lot of collaboration and integration of content behind the scenes, so I thank you for all that pre-work. As far as timing, we will be a bit tyrannical because it is a packed agenda, so I apologize in advance for that. And finally, another pre-apology, and that is that I think we'll just stipulate that everyone in the room is very impressive and has long lists of credentials. Their bios are available for you on the table outside the room, and so I will be giving abbreviated introductions.